Hello everyone, my name is Jordan Cullens, and I'm from the small town of Sandersville, Georgia. I attended nursing school at Georgia Southern University, where I graduated with my bachelor's degree in 2017. After graduation, I moved to Charleston, South Carolina, where I began my nursing career at the Medical University of South Carolina in the neonatal nurseries department. However, I quickly realized I was ready to learn more and challenge myself further by taking care of more critically ill patients. So I transitioned to one of the nation's top-ranked pediatric cardiovascular ICUs at MUSC. As a nurse in this unit, I provided care to critically ill patients of all ages with various cardiac defects and comorbidities, and I feel like I gained valuable knowledge and skill sets that have made me into a more competent ICU nurse. I've learned about different medications and how to titrate various drips to provide hemodynamic stability. I've managed advanced airways, gained more understanding of mechanical ventilators and the different settings. I've also ensured adequate levels of sedation and pain management through administering medications. And all of these are significant responsibilities of a CRNA during a surgical procedure. I've also gained experience with several types of ventricular assisted devices, as well as provided care for patients on continuous renal replacement therapy and on ECMO, and even following heart transplantations. So while working in a high acuity ICU like this has its own challenges, such as managing code events, crashing patients onto ECMO, and even dealing with the death of a patient, I believe one of the most difficult situations that I've encountered during my professional career was my recent transition to my new role as a nurse in the pediatric ICU here in Augusta at the Children's Hospital of Georgia. I had been working in the pediatric cardiac ICU for a little over a year. I was very confident with my cardiac patients. I was very knowledgeable about their defects and was comfortable and confident in my ability to effectively care for these patients. I was familiar with my whole medical team and their expectations, so I found it very challenging to kind of leave my comfort zone of my expertise in pediatric cardiology. But I knew that being able to broaden my patient population to caring for patients with other diagnoses and critical care needs in the PICU would help me become even more of a well-rounded, competent ICU nurse. Even though I did have some experience in the ICU, I knew that I was still lacking knowledge about, some of the different types of patients I would be caring for in this new unit. So I kind of shifted my perspective and viewed it as a huge learning opportunity to help prepare me even more for furthering my education. As a nurse in the PICU, I have cared for various diagnoses and comorbidities. I've cared for patients with neurological injuries, having to monitor intracranial pressure and managing external ventricular drains. I've treated patients with diabetes who are in a diabetic ketoacidotic state. I've also cared for trauma patients that have been involved in motor vehicle accidents and accidental drownings. So during my orientation period at this new unit, I reached out to my preceptors and my nurse manager for resources to learn more and prepare myself more to be able to take care of these types of critically ill patients. One significant resource that I found was studying for my CCRN. I've been studying the past couple months and I was fully prepared to take the exam this month. However, due to all the precautions being taken with the coronavirus, I did have to postpone my exam date, but I feel very prepared and confident to be able to take and pass that exam whenever it's safe to do so. But through my studying, I have learned so much about the different types of patients that I've been caring for in the clinical setting in the PICU. Even though I was nervous to kind of make this transition into a new role, I was very excited to challenge myself more, to gain more experience and knowledge for caring for patients outside of the realm of pediatric cardiology. I adapted to this transition by seeking out resources to increase my skill set and increase my knowledge to become an even better ICU nurse. I've already been able to utilize the knowledge that I've gained through just studying for the CCRN to be able to improve the quality of my daily nursing practice in the PICU. I've always enjoyed learning new things, challenging myself to improve my skills, and I know that these experiences are continuing to to prepare me even more for going back to school to become a CRNA. I have found my passion within the pediatric population, and I'm also very passionate about the anesthesia field, in the future I hope to be able to combine the two to pursue a career in pediatric anesthesia.